cranial nerve number 1 or the olfactory, you need to ask the client to sit in a comfortable position, and then ask the client to upload the one nostril. Can you take off your mask? And then can you upload your one nostril? This will help to remove the excess mucus that has on the nose of the client, and then let the client close the eyes and ask the client to identify the scented object that you have. Normally, the client can identify the scented object, and the abnormal findings will be a neurologic anosmia, or the client cannot identify the scented object, or the client has a lesions or tumor in the frontal lobe. The second assessment I am going to do is the optic or the cranial nerve number 2. And I'm going to use this knowledge chart for assessing the vision, and let the client read the letters. Can you read the letters? E, F, D, N, G, L, P, E, T, I, A, F, A, X, I, N. So as you can see that the client can identify the letters and has a 20/20 vision, and that is the normal findings, and the abnormal findings is that the client has a difficulty in reading the chart, missing letters, and squinting of the eyes. The second assessment of the optic is assessing the near vision. Let the client read any books or newspapers. Can you read this now? Read the following dates and then hear the steps of analysis. The normal findings is that client can read without difficulty and in 14 inches, and the abnormal findings is that client has a difficulty in reading and will move the book or the print closer to the eyes, or the presbyopia. To perform the confrontation test, you need to position yourself, or the examiner will position 2 feet away from the client, and then ask the client to cover her eyes or his eyes, as well as the examiner will also cover the eyes. And then the examiner will move finger, superior, inferior, lateral, and nasal. Superior, inferior, lateral, and nasal. Normal findings is the client and the examiner can see the fingers at the same time, and the abnormal findings is that absent or reduced indicated that there is a reduce in peripheral vision. The next assessment is to assess the oculomotor, the trochlear, and the abducens. The first one to assess is the margins of the eyelids. Check if it is the eyelids is symmetrically or bilaterally equal. And the normal findings is that the eyelids covers 2 millimeters of the iris, and the abnormal findings is that the drooping of the eyes or the ptosis. To assess the extraocular movements of the eyes, you need to ask the client to focus on the object that you are holding, and you need to move the object clockwise.
So by doing this assessment,
and let the client's eyes follow the objects that you are holding.
okay, so the next step is
The normal findings is that the eyes is coordinated and can follow the movements of the objects in all 6 directions. the abnormal findings is the nystagmus or the limited movement of the eyes in all 6 directions. To assess the papillary lightless response, you need to use the pen light and then light the eyes of the patient.
Okay, so the next step is to test the corneal reflex. So by doing that, one is working.
And then the normal findings is that both pupils
Now
will
we're going to
constrict.
assess the patient. And then
And the abnormal findings is that unilaterally dilated pupil is unresponsive to light. The next assessment is the cranial number 5 or the trigeminal. Ask the client to clench the teeth. And then you will palpate the temporal masseter using the pointing finger and the middle finger. The normal findings is that the temporal and the masseter contracts bilaterally, and the abnormal findings is that when the client will clench, it will occurs a painful simulation.
so now it's
The next assessment is to test for the sensory function. Tell the client to touch the forehead and the cheeks and using a paper clip. And ma'am, can you please take off your mask? And then ask the client to close the eyes. And then let the client identify where are the areas being touched, or if it is a dull or sharp sensation. Can you tell me, ma'am, if the area? Specifically, ma'am, on my forehead. Is it dull or sharp?
pen light mo.
How about this one, ma'am? Is it dull or sharp?
Ang wala.
Only dull and sharp, ma'am. Which one? Okay. And then, the normal findings is the client can identify the sharp or the dull object. And the abnormal findings is that there is a lesion on the spinothalamic tract, or the client cannot identify the dull and the sharp object. To assess or to test the corneal reflex, by using the whisk cotton, touch the cornea of the clients and ask the clients to look away. Can you please look away, ma'am? Can you please go this side, ma'am? Normal findings is that eyelids blink bilaterally, and the abnormal findings is that there is a lesion in the trigeminal nerve or cranial nerve number 5. The cranial number 7, the facial, ask the client to smile, to frown, with wrinkles on the forehead, and then show teeth, and then puffed out cheeks, and then raise your pursed lips, and raise your eyebrows, and then close your eyes against resistance. And then the normal findings is that the client smiles, frown with wrinkles on the forehead, the showing of the teeth, the puffed out cheeks, and the pursed lips with closed eyes against the resistance are symmetric in movement. And then the abnormal findings is that the movement is not symmetric and also can be seen in Bell's palsy. To test the sensory function of the cranial number 7, you need to use a tongue depressor, and you need to touch the anterior 2/3 of the tongue with a moistened applicator, and then dip it with salt or sugar or any foods that you have, and let the client identify. Can you identify the flavor, ma'am? So the normal findings is that the client can identify the flavor. The abnormal findings is that if the client cannot identify the flavor, or it suggests the impairment of the cranial nerve number 7. So the next assessment is the cranial nerve number 8, the acoustic vestibulocochlear. In this area, you need to use the tuning fork to assess the hearing or the conduction of the client. In using the tuning fork, you need to strike the tuning fork and put it on the patient's head. So the normal findings is that the client can feel or hear the vibrations in both ears, and then the abnormal findings, if the client cannot hear the vibrations, is maybe indication of the destruction of the environment noises. So the second procedure is by doing the Renee's test. You need to strike the tuning fork and put it on the master process behind the client's ear, and after that you need to put the tuning fork beside the ear. I can hear and feel the vibration. So the normal findings is that the air conduction is longer than the bone conduction, but not as twice as longer than the sensory neural loss. So the abnormal findings is that sensory neural hearing loss may be indicated of the inner ear infection. To test the cranial nerve number 9, the glossopharyngeal, and the cranial number 10, the vagus. To test the motor function, ask the client to open the mouth. Can you open the mouth? And ask the client to say and note the movement of the uvula. So the normal findings is that the uvula and soft palate rise bilaterally and symmetrically. And the abnormal findings is that the palate does not rise bilaterally, and because of the lesions of the cranial nerve number 10 or the vagus. To test the client's gag reflex by touching the posterior pharynx with tongue depressor. So using the tongue depressor, ask the client to open the mouth, and then you need to touch the uvula. So the normal findings is gag reflex is intact, and the abnormal findings is that gag reflex is may be seen with lesions of cranial nerve number 10 and 9, the glossopharyngeal and the vagus. To check the client's ability to swallow, you need to give the client a water or juice.
So the normal find is that the client partly identified area has been touched, and the abnormal find is that they have been able to partly identify the object.
And as the client drink the water, you need to check this area if there is no hoarseness or
So next is to test
any
anesthesia.
difficulty in swallowing. So the normal findings is that the client swallows without difficulty, no hoarseness is noted. The abnormal findings is that dysphagia or hoarseness may be indicated with a lesion of cranial nerve number 9, the glossopharyngeal, and the vagus. To test the cranial number 10, the spinal accessory, ask the client to shrug the shoulders against the resistance to test or to assess the trapezius muscle. Can you shrug, ma'am? Shrug. So the normal findings is there is a symmetry, shrug, contraction, and of the trapezius muscles, and the abnormal findings is that asymmetric movement of the muscle contraction or drooping of the muscles or the shoulder may be indication of the weakness due to the injury. To assess the cranial number 9, the hypoglossal, ask the client to protrude the tongue and move the tongue left and right against the resistance using a tongue depressor.
For abnormal findings, inability to identify the direction of the movements may be seen in posterior column disease or peripheral neuropathy. To assess tactile discrimination, remember
can you,
that the
sir,
client should
please
have eyes
protrude your
closed to
tongue?
test diagnosis.
Say, open your
Place
mouth.
familiar objects
then
such as quarter, paper clip, or
Move
tape
your
in client's
stick out your
hand
tongue, sir.
and ask the client
And
to
then move the
identify
tongue to the left.
Okay, ma'am, I'm going to put
And
some
then
in your hand.
the
and
right.
please close your eyes. And I tell
Okay.
you what.
And the normal findings is that the clients can tongue moves symmetrically, and then the abnormal findings is there is a fasciculations. The next assessment is you need to ask your client to turn your head to the left and to the right, and by also using the strong resistance. Can you turn to the left now? And to the right. There we go. So the normal findings is that there is a strong contraction of sternocleidomastoid muscles and to the left and to the right. And the abnormal findings is there is an atrophy with fasciculation.